Hello everyone, my name is Dr. Yogita BS. I am the Associate Professor in the Department of Anaesthesiology. Today we are going to learn about a life-saving procedure, that is how to provide a basic life support system. So as the name suggests, it is a basic procedure, but it should be done in a systematic approach so as to ensure adequacy and efficiency so as to save lives. So let's begin with it. Along with my postgraduate students, we will be demonstrating this on a mannequin. It is like a simulation class. So first thing is scene safety. So as they announce in the flight that you have to wear your own oxygen mask first before helping others to put theirs, it's the same way we have to check for the danger signs for ourselves and then enter the scene. Like for example, the scene is at the heavy traffic jam area or with a mob attack where you can get hurt yourself. So take the help and then enter the scene. Or for example, it is at the places at the fire is there or toxic chemicals is around, then wear the personal protection equipment and then enter the scene. So first, once you enter the scene, so first step is checking for the responsiveness, and it is done by two ways. One is verbal, the other is by the touch. So the first one is clear and loudly you call for that person and ask if he is okay. Are you okay? Then the next is the touch sensation if it doesn't respond. So tap on the shoulders and look for the responsiveness if the patient responds or not. So once we check the responsiveness, if the patient is unresponsive, then you should ask for the help around the bystanders, okay, and then call for the help. In our country, it is 108 for the ambulance service and 112 for the emergency provider system. Okay, so once we call for the help, then check. The second step is checking for the pulse. The pulse is checked at the lateral neck groove along with the 2 or 3 fingers. So this should be done within 10 seconds. You check the pulse and then you check for the breathing. So now you can be at 3 settings. One is where the pulse is felt and also the breathing is normal. In that time you have to just monitor the patient and then wait for the emergency until the emergency response team arrives. The second scenario is the pulse is felt but the breathing is abnormal. That time you are supposed to give only rescue breaths. So you are providing only support for the breathing. That is like around 10 breaths per minute. Like every 6 seconds you give 1 breath. Okay. The third setting is where there is no pulse and there is no breathing also. That time you have to start with your chest compressions. So how do we give the chest compressions? So kneel beside the patient and then place your one hand at the center of the chest. Place your other hand and then interlace it and then lock your elbow and then start pushing. This is how you give the chest compressions. 1, 2, 3, 4, 5, 6, 7, 8. Be loud and clear so that whoever is helping you also is following the instructions. Okay. So once we give 30 chest compressions, then we give rescue breaths. How do we give the rescue breaths? First, do the head tilt and chin lift. Okay, so that you clear the airway. Then pinch the nose of the patient, take a breath and then seal your mouth with the patient's and then give breath like this. You have to see a chest raise. At least for a second you have to give breath. Okay. So one breath is 1 second. So you have to give 2 rescue breaths and then continue again with the 30 chest compression. This is how you do the chest compressions with the rescue breathing. So after every 2 minutes, check for the pulse and check for the breathing. So meanwhile, if you get an AED, how do you use it? So this is a AED machine. This is an automated external defibrillator. This is the pads. It will be available. So the first pad, one pad should be put right below the right collarbone. And the second, as it is shown in the picture, where it is to be put. It is to be put here. Okay. And the second one, the second pad should be put at the left lower chest. So once you place the pad, you plug in. This is the plug-in. First on and then plug in. Okay. Then the AED will be analyzing the rhythm and it will only tell if it's a shockable rhythm or a not shockable rhythm. So if it's a shockable rhythm, the AED analyzes and it tells shock has to be delivered. Then you clear and then the shock will be delivered. Then continue the CPR. This is where most of us make mistake. So it is like after giving the shock, we will immediately check for the pulse. That is not to be done. We have to give the shock and then continue the CPR for 2 minutes and then check for the pulse. So that's how it is done. So continue the CPR. Once the you and the AED patch should be on only. You continue and the AED will prompt you that rhythm has to be checked, please clear. Then you clear and then let the AED check the rhythm and tell again whether it's a shockable or non-shockable. If it's a non-shockable rhythm, you continue with the CPR. And this has to be done until the ROSC is achieved, that is return of spontaneous circulation. Okay, the pulse should be felt and the breathing should be normal. Or the emergency providers come, then you will give the space to them. Okay, so this is how it is done. Now, our PG students will demonstrate the BLS stepwise approach. Let's see. Asha, cut madbidi. Okay, let's start with sit.
Hey, someone has fallen. Let's check on him.
Are you okay?
Are you okay? He's not responding. Call emergency services. If an AED is available, bring it.
Calling 108.
He doesn't have a pulse. He's not breathing. I'm starting CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
30 tester preparations are done. I am giving 1 rescue breath. 2 rescue breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Everyone stop. AED is analyzing.
So AED is analyzing the rhythm. Everyone clear?
Shock advised. Charging. Stay clear of patient.
Clear.
Deliver shock. Shock delivered. Start CPR.
7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 25, 26, 27, 28, 29, 30.
Stop. 2 minutes are over. Let's check the pulse.
The patient is breathing.
Pulse has
The
returned.
pulse is back.
Okay, the patient is breathing and the pulse is back. Let's analyze the patient and wait for the emergency services.
So this is what is the basic life support algorithm, stepwise approach. Thank you all. So 2 hands can save lives. So push
Push harder and push faster.